This is a Spanish Chamber of Commerce in Hong Kong live webinar event, and was is being held in collaboration with the Medical Licentiate Society of Hong Kong. I'm Dr. Marcet. I'm a private practice specialist in ophthalmology here in Hong Kong, and it's my pleasure and honor to help host this event. Today is March 25th. We're about 2 months now into the coronavirus outbreak, and tonight's title that we'll be discussing, our topic is Pandemic Strategy, Staying Healthy During COVID-19. I'm joined by 3 distinguished panelists, Dr. Sarah Borwein, Dr. Raymond Cho, and Dr. Christian Choi. And I'm going to like to ask each one of them to tell us a little bit, just a brief bio about themselves. First, I'd like to say thanks, a big thank you to all of our attendees, especially we have some folks from literally on the other side of the world, in the US, where it's like 6:30 in the morning Eastern Standard Time. So welcome to everybody. We've had a relatively modest response here to the situation in Hong Kong, attributed to the response of the authorities here. So hopefully we'll be able to bring some very practical and useful information for everyone. Sarah, would you like to start off and tell us a little bit about yourself?
Sure. My name is Sarah Borwein. I'm a Canadian-trained family physician, but I've lived and worked in Hong Kong or China for well over 20 years. I was in Beijing for the SARS epidemic, so this is my second go-round with SARS. And I also have a master's in infectious disease from the London School of Hygiene and Tropical Medicine. So this is kind of my area of interest, and I'm very happy to be with you here tonight.
Thanks for joining us, Sarah. Raymond, how about yourself?
Hi, everyone. My name is Raymond Cho. I'm an American-trained pulmonologist and critical care medicine. I've been back to Hong Kong since 2007, and I'm delighted to be here tonight.
Thanks, Raymond. Chris, can you tell us a few words about yourself?
Hi, everyone. I'm Dr. Cho, and I'm originally from Hong Kong. I was trained in the UK as a forensic psychiatrist, actually, but I've been back in Hong Kong since 2014, and I've been working in private practice since then. So I'm here. I'm happy to help you guys here to answer any questions on mental health.
Oh, great. So let's get right into it then. Thank you all to our panelists. Our first question, and these questions have come from the folks out there that have been kind enough to send us the questions ahead of time. What we're going to do is go through those, and then if we have time later, we'll definitely include some of your questions. Please go ahead and type those into the chat window, and we'll get those addressed later. Our first question, folks have been hearing about how to treat coronavirus and what can they do. But Raymond, can you tell us what to reduce your chance of infection? What can people do to minimize that risk?
All right. It's all over the news. So I think the most helpful and useful way is washing your hands. Wash them for 20 seconds with soap and water. If you don't have soap and water with you, then the alcohol sanitizer are also helpful. Try not to touch your eyes, nose, and mouth with your fingers. Avoid close contact with the ill, and practice social distancing. And this has been very useful in this part of the world.
Okay, thank you for that. Sarah, we just heard how the Tokyo Olympics were actually postponed for a full year. What about for everyone that's just out there that's not necessarily an Olympic athlete, but they just want to keep fit at home? How can you keep fit under quarantine? Do you have any recommendations?
Well, yeah, I mean, obviously, if you're an Olympic athlete and it's been impossible for them to train, so they, of course, made the right decision. But if you're at home, it kind of depends on whether you're in self-isolation or quarantine, because or the level of social distancing you need. Here, many people are not under quarantine, but they're just isolating themselves or practicing social distancing. And in that situation, it's actually okay to go outside and exercise outside as long as you're not in a crowded area. But if you're actually in quarantine here, and in some parts of the world really in more of a lockdown situation than we are, then you need to act inside. And there's actually no excuse these days because there's so many things you can do indoors. There's a million videos on YouTube telling you how to do yoga and short, high intensity workouts and just about anything that you want to do. So I think you take advantage of those things and you work out indoors.
Okay, thanks for that. My next topic, I'm going to try to relaunch this poll here, and let's just see if that works out. Are you guys seeing that on your screens?
Yes.
Okay. So just, it's a multiple choice. PPE is personal protective equipment. The results will be available in just a moment. We'll allow a few more seconds for you guys. Everyone can vote except the host. I wish I could vote too. I wanna, but the software disallows me from that. So everyone else can vote. Come on in. I see almost everyone. Few more. Go for it. Take a look. We've even got sort of a strange one at the end there because I did actually hear about that. So I wanted to include that. I won't get into locations. It wasn't here in Hong Kong, but some of the folks have been using some unofficial PPE. Okay, well, that looks like it's about everyone. Going to end the poll there, and let's share those results. Okay, can you guys see those results there? You know, that leads us to the next question. Sarah, maybe if you could comment, it looks like 100% of folks are using the surgical mask. Do they help?
Yes, actually, I think they do help, and I think that it's good that people are using them, as long as there isn't a huge shortage that they're needed for the frontline healthcare workers and first responders. Otherwise, they do add some defense, and they do it for a couple of reasons. One is that we know that this disease is spread when people are not symptomatic, or when they're about to become symptomatic, so pre-symptomatic. And masks are best at protecting you from giving the disease to someone else, to prevent you from coughing out respiratory droplets or breathing them out or sneezing them out. But if you don't even know you're sick, then you don't know when to wear a mask. So it's helpful if everybody wears a mask, then we all protect each other. And there have been some studies that show that universal mask wearing does have some effect on slowing down influenza outbreaks, for example. So we do think it's helpful if people wear masks. There's another issue here in Asia, which is that mask wearing is a very important part of the local response to this epidemic. It stems back to the SARS era. And so it's kind of a mark of respect to wear a mask. It says, I respect your customs, but also you wear a mask out of respect for protecting other people. So you don't wear it as much for yourself as for other people. And so I think for all those reasons, it is actually a good idea to wear masks.
Okay. And from our poll, I think all of our attendees can see that as well. It looks like 91% are using hand sanitizer and or soap. I'm going to take the results down. There's also face shield, and a third were using eye goggles as well, interestingly enough. So what about these other types of personal protective equipment? How effective are those?
I can answer that if you like. They're mostly used in hospital healthcare settings when there's going to be more close contact with sick people that we know are sick. And but some form of eye protection in those settings is important because we think the virus can get in through the eyes. And some people, if you wear glasses anyway, then wearing glasses is a good idea, but you probably don't need in a regular setting anything more than washing your hands and wearing a mask.
Raymond, how about yourself? I know that sometimes you do some more what's so-called at-risk procedures. Are you doing additional protection?
Yeah, I think it's more for the hospital workers that they are in direct contact with the infected people, and also if they get contaminated fluid that will be splashed to their face, the goggles might help. But in day-to-day, like when you're in the subway or in the bus, I don't think the chances of you getting spilled with these contaminated fluids will be much less. So I don't see the utility of these face masks or face shields or goggles. Yeah.
But for the surgical mask itself,
yeah, it does definitely help. Yeah.
We got an additional typed in question just now on that. So thanks for clarifying that. How about, speaking of this personal equipment, are we running low on medical supplies in this in the private practice setting?
I think in the private practice, so far it's well stocked, and also in the public sector, they have a good more than a month supply. So currently it's okay.
Sarah, how about
Actually,
you?
something in the paper today about the fact that people in Hong Kong are now sending masks to their relatives
Yeah,
overseas.
that's
Yeah, well,
right.
that's interesting you mentioned that. The Spanish Chamber itself, this being a Spanish Chamber event, they just launched an initiative to send some masks to Spain because of the situation over there. So, one of the things that comes up a lot, kind of an FAQ, is about when people say comorbidity or underlying medical condition. You hear those words a lot. What do people mean by that? Raymond, can you maybe comment on what's an underlying medical condition?
Most talked about by the Chinese studies, the comorbidity disease or underlying disease, a cardiovascular disease, diabetes, respiratory disease such as COPD or asthma, and hypertension. And these four are mostly quoted in their papers as the high risk group.
And speaking of risk, when people when they're worried about it, or they've traveled, or they know somebody, maybe their friend or family has it, they might want to get testing. How accurate are the COVID-19 tests? Sarah, do you want to maybe comment? I know you guys are doing
Yeah, and specifically in the context of people who don't have symptoms, they do have some limitations for sure. There's two main kinds of tests. One is the PCR test, which is the test that's done on a swab or on saliva samples to actually detect the DNA of the virus. And that's sort of the first test that became available. It's the most widely used test. It actually only has a sensitivity of about 75%, even in people who are sick. And in people who are not sick, it's going to be lower than that. So it is used sometimes in mass screening programs in people. Like I think here they're screening a lot of people at the airport as they come in with saliva PCRs. And that has some use because they're really just trying to, get some of the people who are actually already sick out of the pool right away. But they're not great for screening asymptomatic people. We know that a lot of people, even symptomatic people, sometimes test negative once or twice before they test positive. And some of the sickest people don't even test positive on that test. They only find it in the lungs. So there's also another kind of test, which is the serology, the blood test that looks for the body's response to the virus. And that test also is quite a good test, but it doesn't become positive until you've been sick for a little while, on average about 7 days before it becomes positive. So again, if you're wondering if you've had an asymptomatic infection and in the past, you might be able to pick it up with that, but it's most useful either in a hospital setting where people have been sick for a number of days, or for mass screening after the epidemic is over or when it's waning, when you're trying to figure out how much the population actually got this.
Now, what about for people, what if you're feeling sick, Raymond? Like can you comment on that for us? If someone's already been sick, what do you do?
So I would recommend to stay home, drink plenty of water. Use Panadol for fever, or take some vitamin C. And if the symptom really getting bad and with some shortness of breath, then I would advise them to seek medical help.
Okay. Maybe more for the general practice setting, but we've gotten some questions about whether essential oils are effective against the virus, or homeopathic doses of chloroquine product and other miscellaneous things. Sarah, what is in your general practice setting? How are you counseling folks on that?
Yeah, no, that those things are really not effective. Essential oils might be good for your mental health. They might make you feel good. So that might be a use, but they don't prevent the coronavirus. There's a lot of mythology out there about if you drink enough water, you can keep your throat moist and not get it. That's not true. If you spray yourself with alcohol, that doesn't work either. Probably just damages your clothing. It doesn't work to cover yourself in sesame oil. It doesn't work to take large doses of garlic. And definitely don't take chloroquine without medical advice. There's even one that says you should drink dilute bleach. Also, Don't do that. It's not a good idea.
Okay. What about if you're feeling suspicions of like COVID-19 or you've been in contact with an infected person? Can you guys comment about that? Maybe Sarah, I know you guys have been having interaction with travelers.
So first of all, if you actually are, like, have been in close contact with somebody who has the disease, the Department of Health is likely to find you, in fact, and screen you. They're pretty good at that. But if you are sort of maybe not quite in that close circle and you're worried, and you feel, especially if you feel sick, then you can present yourself to any of the general outpatient clinics or to the A&E. But you can also approach your family doctor or your GP. I'm not sure what all clinics are doing, but our clinic, we do telephone triage of patients. We mostly do telephone consults, and we can arrange testing remotely. Basically, we send you the test kit, and you do the test at home and then deliver it to either back to us or to the lab.
How about you guys, Raymond or Chris? Are you guys also doing some phone consults as well? Is that becoming more common or the norm?
Well, I should be thinking of it, yeah, but I'm not doing it right now, I mean.
Okay.
I think, Raymond, you don't see such a high-risk population, or your patient population is one that you need to see in person.
Yeah.
Maybe for the pulmonary exam, it doesn't lend itself to listening to people's lungs. Not yet, anyways.
Yeah.
I did have a good go at looking down someone's throat today over Skype.
The eye exam would be a challenge. We're going to end up a proper eye exam. We're not set up for telemedicine either. Not for the anterior part of that.
It's not ideal, but many countries are doing it. In Canada, it's becoming a big thing, doing general practice consults, because it protects everybody. And it also allows for the clinic then to be a safe place where people can come to get other things cared for. And so it is, in many countries, part of the pandemic planning is to move many, and it's not ideal, but it's the best we can do in this situation. Yeah.
I should add parenthetically that ophthalmology is well versed with telemedicine, but it's more the back of the eye, the retina screening exams. Yeah. I've heard some talk about private clinics being able to refuse patients carrying when they're arriving from countries that are at risk or they haven't done 14 days of quarantine. Raymond or Sarah, can you guys comment about that? Is it true that they can refuse private patients?
Yeah, it is true. I mean, most of the private hospitals now refuse any patients who are suspicious or confirmed cases for COVID-19. I think it's better off for spilling the infectious disease into the private hospitals. So it's now all the COVID-19 cases are going to the public hospital.
Okay, so that allows the private setting to maybe focus on the
other things.
Yeah, and that's really important, because a lot of times when there's a big epidemic, other things go uncared for. It's one of the problems when healthcare systems get overwhelmed. So they did the same in SARS here, and it's one of the things that, so you treat all of the epidemic patients in the public system, and then you shift a little bit more into the private system. It allows the private system to be a safe place where people can have other things cared for.
Okay. Something I just got asked a couple of days ago was, can you get COVID-19 a second time? Sarah, can you comment about that?
No, not really, because we don't know. It's really too early to know. There's been some reports of reinfection out of China, but we actually it's too early to say. We don't even know if the virus has mutated enough to be called different strains, that maybe you could get, a different strain if you'd had the first one, but it's still so unclear. We don't know that for sure.
This leads us to, I have another poll set up, so let's launch that, and it takes us into our next, if you guys want to just go ahead, everyone can answer this except the host. I definitely have an answer in mind. I wish I could. I'll save my answer for after you guys. So I'm seeing about half of the folks. Keep on coming. Just fill that out. Click away, please. We welcome the interaction. We'll leave it open just maybe another 10, 20 seconds to give you guys a chance. Depending on what time zone you're on, you might be in the US with your coffee in your hand. Go ahead and put your coffee down. Welcome.
I have breaking news because I've just received a text that Prince Charles has tested positive.
Oh, wow. Wow.
Oh, no.
Well, you're breaking the news live here. Thanks for that, Sarah. Looks like everyone that's voted, I'm going to go ahead and end the poll there and share the results with everybody. Can everybody see the poll results there? So looking, you guys see it? Yeah? Okay. So looking like 62% are feeling stressed and 15% are maybe. So maybe that kind of leads us into Chris there. Chris, thanks for hanging out with us all this time. People are feeling stressed. Clearly the majority are. And then there's even a few more that might be stressed as well or don't want to think about it too much. Can you tell us about general stress management tips?
Sure. It's actually very interesting results we've got here, but I'll probably look into explaining the almost a quarter of the audience saying that they're not stressed. Well, so far we've been talking about how to protect ourselves from the virus and how to maintain good physical health. But I think it's very important to take care of your mind as well. With the outbreak of the coronavirus, we're all going through a really tough period, as we know. So it's really understandable that we're all stressed out, worried, fearful, of this situation. As stress can affect our mood and also our eating patterns, we might get insomnia on it, from it. So it's actually interesting to see how different people react differently to stress. And I think the poll reviews some of the, the different results. I have a few good tips I want to share with you guys to reduce stress. First of all, I think it's important to be aware of and recognize your feelings of anxiety rather than blocking it. I mean, it's okay to feel stressed about the situation. It's actually normal. What I would advise is for you guys to talk to someone close to you or someone you can trust, maybe to vent feelings, but be careful not to go into like detailed discussions about the virus. Otherwise, it stress you out even more. The second thing is try and take a break from the social and media coverage of the virus. Try and limit yourself and your family, to checking maybe the latest news or development, of the virus from a reliable source, such as the WHO, and the US which called Centers for Disease Control and Prevention. If you guys have kids, try and educate them in a way, or the key aspects of hygiene in a way they understand, so they won't sort of keep asking you the same questions and you get, stressed out from it. I think it's very important to maintain contact with, and healthy relationships with people. Think about how to keep in touch with your friends and family. You can do this, I think, in this situation by phone, other messaging, video calls online, or, other sort of internet platforms. Do use your brain. I think that's important. Develop an interest, hobby that you can do at home. So rather than just watching TV, that doesn't require much thinking. Try and, read a book or, do crossword puzzles or even like do an online course, learn something, As long as your brain is stimulated, it will stop you from getting bored and getting stressed. The other thing is try and eat healthy and balanced diet. And try and sleep well and, stick to a good sleep hygiene, such as avoiding caffeine, sugary drinks before bed. Try and do exercise. That's actually quite important. I know it's difficult, when it's really crowded outside, but if you can go for short walks outside in crowded places, do that. But if everywhere is crowded, then go to the balcony if you have one, or if not, just go near the window and, and you'll get some fresh air. And this is really important for both physical and the mental health.
I had a follow-up question on that, a specific type of stress. I'm not even sure they even call it cabin fever anymore because of the unintended pun. But so for whatever they call being cooped up together, there's a lot of WhatsApp and internet jokes about people, spouses having issues and kids and stuff. It's really kind of the joke of the month or so. Any specific strategies about dealing with this cabin fever or being stuck together for prolonged periods of time?
Well, yeah, cabin fever has been a hot topic sort of to discuss recently. And as we know, the government and the hospital, sort of the health authorities, like urging us to refrain from going out, any social gatherings, social distancing, and work from home. So cabin fever really is a mental condition developed as a result of being isolated, in a building or in a confined place for a period of time. And I think it is interesting when people with cabin fever, they usually experience some sadness, tightness. They might have difficulty concentrating. They might have sleep problems. They might feel isolated and sometimes feel hopeless. So it can also lead to difficulty coping with stress. And I think it ties in with the stuff that I talked about earlier in terms of tips in managing stress. And I think if you guys can apply some of those tips, and that would sort of help with this cabin fever thing.
Are you seeing?
Yes.
Yeah. All right, go ahead.
Yeah, and it's just because I've been seeing quite a few in my patients with existing mental health issues such as anxiety and depression, and people with obsessive compulsive disorders. And it seems that some of them actually relapsed, as in the condition has actually got worse. And I'm not surprised to see them, getting worse these days because of, as I say, the isolation and the stress they get from, being stuck at home. And, people with the obsessive compulsive disorder sort of, keep washing their hands and just getting really
We're all OCD now.
really extreme with their rituals. Yeah. But
I had one more question for you guys, and then we'll get into our audience questions. But it's kind of no one knows, but everyone's asking, how long will it last? Where do we go from here? Any advice at all?
I think that's a really big unknown. And, there's been modeling done, which suggests that maybe we're going to have to deal with this at some level for 18 months or so until there can be a vaccine developed and tested and deployed. Probably not all the time under such strict levels of, complete shutdown, but in waves of it, because you shut down, you get it under control, then you can loosen up a bit, but then it might come back and you have to do it again. So that is definitely looks like the most likely scenario. They call it the hammer and the dance. So you have these periods where you have to bring the hammer down and just really have strict, social distancing and very strict measures. And then there's this kind of dance where you can let up a little bit and have a bit of a life, but not normal. It's not going to be normal for a while, probably. But, one thing about public health is it's always a victim of its own success. If we can really get this, if people really, really, really do get it under control quickly, really do follow the very strict measures like China took and get it under control, it's possible that we can control it more quickly. But it's difficult, and it remains to be seen whether that will happen. If it does, then people will say, oh, we didn't need to be so worried about this. It was all, overreaction. Right?
Raymond, do you have any thoughts on that at all? Any additional?
Yeah, I mean, it's a big question at the moment. I mean, everyone would like to know. I mean, I've seen US is going to release their lockdown very soon because of economical concern. Time will tell whether that will be a smart decision or not.
Chris, any final thoughts?
Yeah, no. There's a recent study published by the Lancet. I think it was only freshly out end of last month, looking at the psychological impact of people being isolated and quarantined. I think it's a review article and has looked at thousands of people, and there are some suggestions that the impact psychologically is huge, and but I think the conclusion is that I think the way it is at the moment is important to keep on isolating people who might be at risk of having the disease. And they looked at sort of the benefits of continuing the quarantine and continuing the isolation. Actually it outweighs the risk of the disease spreading, because if the disease spread, and we are going to go down, and just let alone sort of physical and mental health side, our lives will be all at risk. So I think we just have to bite the bullet now, everyone, and just have to stick to what needs to be done, and then fingers crossed that this thing will be over sooner rather than later.
Yeah, let's hope so.
I like the term physical isolation better than social isolation.
Yeah.
Yeah, because we don't have to be so socially isolated. Thank goodness for the internet and this kind of platform and the ways that we can stay connected to people. But sort of the final thought is it's not over anywhere until it's over everywhere.
That's a great one.
Yeah, so we do need to keep going for a while.
I'd like the panelists to take a look. We've got a couple of questions in there that maybe you can just take a look at those. And at the same time, definitely feel free to type in some questions from our attendees. So we can, the first one I believe we've addressed, that's how effective are, okay, great, some more questions coming in. How effective are surgical masks? I think that we touched on that earlier, but maybe for folks that dialed in later, if I could suggest that yes, they are effective, particularly in reducing the transmission from the person that's wearing the mask, spreading it to other people is what's been shown to be most, and feel free panelists to add to that. The next one is, apparently there's a rumor in Spain that using ibuprofen, apparently it can worsen the COVID-19 symptoms. How true is that?
It's not a rumor. WHO actually issued a statement saying that they have seen people getting worse treated for their fever using the ibuprofen rather than Panadol, paracetamol, in treating the COVID-19 symptoms. So the current recommendation is avoid ibuprofen class, NSAID class of medications, and use paracetamol instead.
Okay. The next question, I'm going to skip that. And Raymond, if you would take a look at that, because that's more of a pulmonology question. So if you want to just take a moment to look at that. And in the interim, if I could ask Sarah about the possibility of COVID virus mutating. What's the key difference between a pandemic and endemic?
Okay, well, and epidemic. So I'll start with that maybe. So an epidemic is a spike in the incidence of a disease above the normal background. And a pandemic is really just an epidemic that is spread globally around the world. So endemic means that it's there all the time at low levels, but we sort of have it all the time. Like, influenza is kind of an endemic disease that becomes epidemic at times, but there's many things that circulate all the time at low levels, and those ones are endemic. And really right now we're dealing with pandemic for this particular virus. The other question was about mutating. It is an RNA virus, and RNA viruses are quite sort of renowned for mutating. That's why you have to get a different flu shot every year, because the flu virus mutates easily as it passes from person to person. This virus initially looked like it was pretty stable and that it wasn't mutating much. That is coming under some question now, whether in fact there has been some significant mutation already, but it's still a little bit early to know. They're not, if there's different strains, they're very similar to each other still.
And the next one, thank you, Sarah. The next one is for Raymond. That was the one just before.
Yeah, it's the question's from Karen. So I guess your question is asking how to differentiate between the COPD and asthma exacerbations rather than the COVID infections. I mean, right now the tests are readily available if they're symptomatic. In the public hospital or even the private sectors, you can get it tested. Obviously, any infection will induce an exacerbation for COPD or asthma. So it's better to rule it out if that person deems to have some travel history or sick contact that make them suspicious to have a COVID infection. And But I guess symptomatically, if you have an exacerbation of COPD due to an infectious cause, you have to treat both, basically.
Okay, great. Thank you for that. Our next question is from Nick. Are there any risk of the virus sticking to food, vegetables and produce bought from a supermarket or wet market? Do they need to be treated specially compared to usually just rinsing and cleaning with water? Anyone want to take that one on?
Just wash them well.
I can take that. I mean, this is an RNA virus. I mean, it's a very thin cell war, so that's why it can be killed by soap. So it's not like a really fancy virus that's not eliminated by anything. So it's just soap and water itself can kill it. Obviously, with enough heat when you cook it, it will kill it, and just wash it well. I think that's a key to it. Yeah.
What about, in the news, this is my question, delivery packages. People have been getting a lot of different deliveries to their home. What about the packaging on that? Apparently a little bit lower risk with cardboard. How about the delivery boxes? Anyone want to?
It's probably a good idea to wipe them down,
Sure.
but nothing more than that.
Okay. We've got another one, folks. Feel free to type more questions in. We'll keep taking them. Thank you for those. So once someone has had the virus, this is from one of our attendees, will they be immune from further infection? I think that goes back to the other question. Could they get it? They get it twice, but they're asking, will they be immune from further infection?
Don't know yet.
Yeah, don't know yet.
Yeah.
Just like flu, if you get the flu, you're probably immune from that strain that year, but you can get the flu another strain, or you can get the flu again next year, and we don't know if it's going to be like that or not.
So media reports about like the mortality rate is higher in Europe, for example, right now. Is that too soon to tell whether that's just a different strain, like it's gotten worse or mutated, or it's just the reporting potentially could be different?
It's not, I don't think it's the reporting. I think it's the fact that their healthcare systems are overwhelmed. And we saw the same thing happen in Wuhan at the beginning. When the healthcare system's overwhelmed, and there's many studies that show this, when the healthcare system is overwhelmed, the death rate goes up at least tenfold. Mm. So because people, a significant minority, most people get over this on their own, but there's a significant, 15 to 20% of people who really need good hospital care, and some of them need ventilators. And if there's not enough, those people many of them are going to die. So, but they could be saved when the healthcare system isn't completely overwhelmed. I think that's more of what's happening in Europe and in Iran and in places like that.
Yeah.
Absolutely.
If I could ask Chris, I guess I'd like to ask the mental health version of this immune from further infection. Are you expecting there may be some post-traumatic stress disorder cases after all this coronavirus outbreak or anything like that? Or is there going to be some lasting effect, you think? Or is there maybe overcoming adversity? Is there a positive value to that? Any comments on that, or anyone from our panel, really?
Well, certainly I haven't got anyone who suffers from post-traumatic stress disorder, PTSD, from the outbreak at the moment. I think it's too early to say. It probably takes a while for the disorder to develop. But certainly amongst the patients I have, the ones with PTSD, they are not doing so well at the moment, because of the news flying around, and they already, the symptoms they have, it's irritability, hypervigilance, it's just generally, the defense in terms of the coping strategies are actually quite weak, given the fact that they have the disorder. I would expect the people who have been quarantined for a period of time would develop PTSD or some sort of adjustment disorders or reactions. So yeah, I mean, time will tell, really, but I would expect a proportion of those people would develop some disorders.
Thank you for that. Our next question is asking about the Italy strain versus a possible different strain. in China? Is there, that kind of relates to the theme we were just talking about, actually. I mean, it's a variation on the same question. So yeah, to summarize our previous, too soon to tell and different, is that?
There is some theories about it, but it's not really definitive yet.
Okay. Anyone else? Any other questions? That we've gotten through everyone's questions. Thank you all for that. If there's no further questions, we're going to be closing our session tonight. I want to thank everyone for joining. It's been a pleasure to have this opportunity with you guys. And in the feedback, please feel free to reach out to us. Let us know if you'd like this kind of experience and you'd like to see more of it. We'd love to keep working with you on that.